Well, good afternoon. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in St. Clair County. And with me today, we have Dr. Annette Mercatante, the St. Clair County Medical Health Officer. And we're here today to give you the weekly update. So we'll lead off with the stats for the week. In the last 7 days, we have 565 new cases. We're averaging 81 new cases per day. We're averaging 688 new tests per day, and we have a 16.9% positive of those new tests. Currently, totals to date, 6,131 total cases. To date, we have 322 hospitalized. We have 118 deaths and 2,568 approximate recovered. So this is our curve, and as you can see, we are sliding down the backside of this now, which is a decent sign. We are by no means out of the woods yet, but we are falling down on a downward trend, which is moderately good news. The percent positive still remains very high at in the 16 plus percentile. So we're still going to keep our fingers crossed. There's still a lot of work to do, but we are seeing some decent trending. So we'll keep our eye on things. And then, as always, you can keep an eye on things on the dashboard at stclaircounty.org/offices/health/COVID19.aspx. All right.
Yeah, and I'll just add, everybody is always interested, and we want to make sure that we know people that our hospital systems are doing well. They're very busy, they're stressed, but they are not at capacity. They're able to continue to see and take care of patients. Their ICUs are not full. And I believe as of this morning, approximately 30% of their inpatient population was COVID related. So busy, functional, and at this time holding their own. So yay for our hospital systems. They're doing great.
That's right. All right. I think we'll take some questions, right, Elise? I think we're to that point.
Yep. So first question is for you, Justin. We got on the feed yesterday. What is the process for who gets the vaccine first?
So the state of Michigan has adopted basically the CDC process from the group that's called the ACIP, and we're going to follow the phases 1 through 5. And currently we're in phase 1A, and phase 1 is going to be in phases 1A through 1C. And so 1A includes the paid and unpaid persons serving in healthcare settings who have direct or indirect exposure to COVID positive patients or infectious material, which could mean lab personnel or couriers who are moving that infectious material back and forth, as well as anybody who is unable to work from home that may have come into contact with either patients or the material, and residents of long-term care facilities. Then we'll move on to phase 1B, and those are workers that are essential to security, or like firefighters or law enforcement personnel or other essential areas of the community, as well as critical industries, including workers with unique skill sets such as non-hospital or non-public health laboratories and mortuary services. Then, once we're done there, we'll move into 1C, which includes people at high risk for severe COVID-19 illness due to underlying medical conditions and people 65 years and older. Once we're complete with 1A through 1C, we'll move on to phase 2, and that's a mass vaccination campaign for all individuals 16 and older. And we expect to be there. It'll take us a couple of months to get through that process.
All right, next question is for you, Doc. What do we know about the vaccine And people that have had reactions to medications before, are we still waiting on the information?
So we have the information that's been released for the Pfizer vaccine, and I would expect the Moderna to be somewhat similar. And that is that the real contraindications will be to anybody who's had a reaction to any component of this vaccine or perhaps any vaccine component. Those will be the people that we would be very cautious about providing vaccine to. The overall risk to somebody who has any allergies is still being looked at. We don't have that final word. We do know that people who have a tendency to have allergies or to have had any anaphylaxis in the past to anything will be monitored much more closely, but still will be still can get the vaccine in those circumstances. So there'll be grades of caution depending on your history, and that will be screened carefully before the vaccine is given.
All right. And this second question goes along with that. Is it safe to take the vaccine if I'm on medication that suppresses my immune system?
So I can only speak to the Pfizer product, which is the only thing we have available right now. And I can tell you that for immunocompromised conditions, they are going to allow people to vaccinate if it's recommended by their healthcare provider under full disclosure that the data is not really there. This vaccine was provided in phase 2 trials to a variety of people, including people who had immune compromised conditions. And so we do know that the safety profile is there. How and some of those more details I think still remain to be seen. But the vaccine can be used. It can be chosen to use by people with immune compromised conditions. It can also be chosen to be used by pregnancy in women who may or may not be pregnant, as well as women who are lactating and breastfeeding. So these are situations where you have to weigh the risk of getting the infection versus your overall condition. And these would probably be things you'd want to discuss with your healthcare provider carefully before making that decision. And of course, the more we do, the longer we go, the more we're going to know, and the more we'll be able to provide you more information about that if you're in one of those special groups. By the way, we're not requiring pregnancy tests for this vaccine. We are not requiring antibody testing for this vaccine. There are no predetermined tests that need to be done. We won't want to give it to you if you're acutely ill, if you're very ill. If you're ill with COVID, we want you to recover, at least be out of that 10-day isolation period. But in general, there are no requirements to make sure that you don't even need blood work prior to getting this vaccine.
All right, next question is for Justin. When will I know it's my turn to get the vaccine?
So as we work through the phases, we'll be very transparent with the public on where we are and whose turn it is. Check with the St. Clair County Health Department website and also all of our social media pages for up-to-date information. And you can find the St. Clair County Health Department website at scchealth.co. Also note that the St. Clair County Health Department currently, we do not have any vaccine and we are not currently vaccinating anyone. We expect to get it very soon, but we don't have any on hand yet.
Yeah, and I just want to add that there's the details about whose turn it is. At the beginning, this is going to be a pulling in kind of thing. We're going to be reaching out, engaging the individuals, the groups that are due, and the priority groups that are ready to get vaccinated, and do those and try and make sure that we cover those bases before we move on to the next priority group. So it's going to be a while before we're saying to the general public, well, if you're in this category, come on over to such and such location for a vaccine. The first, I would say, probably at least the first 4 to 5 weeks of this, we're going to be reaching out to these special priority groups and making sure that they have access to this vaccine first and foremost.
All right, we're still working through the questions from yesterday. Doc, this one's for you. Should people with ITP and have been given platelets take the vaccine?
So, ITP is a medical condition, a platelet condition. There are a variety of autoimmune and immune-related medical conditions people have, and the specifics of which ones are and are not going to be at higher risk, I don't have available to you. As I mentioned before, though, people with immune-compromised conditions will have the option to take this vaccine. And the details of different specific conditions, I'm sure we'll have more information as the vaccine is used more.
All right.
Not the most specific answer, but probably. My answer is, yeah, probably you will be able to get this vaccine, but we'll have to look at it this closer as time goes by.
All right. Thank you, Doc. Next question for Justin. Will there be a cost for the vaccine for the general public?
No. So the federal government has picked up the cost of the vaccine for the general public. So you won't be charged anything for it. It's going to be free.
Providers are able to bill for administrative costs, but there should be there should be no expense to getting the vaccine. You should not get a bill, a copay, anything of that nature.
All right. Next question, Doc. If you get the vaccine or have already gotten COVID, do you still need to wear a mask in public?
Yes. Yes. Lots of reasons for that. One is, of course, we have no idea if this vaccine is going to prevent transmission. We do know that this particular vaccine can reduce symptomatic COVID infection and severe COVID infection. Okay, that's what we know about this. We do not know whether it eliminates asymptomatic infections, for instance. And of course, COVID can be transmitted asymptomatically. We don't know how many people are going to have access to this vaccine or how long it's going to take. So there's still going to be a large majority of people in our communities that aren't vaccinated or aren't immune. And so we have to know, please remember that this vaccine is not the automatic ticket to rip your mask off and throw away all that we've been talking about for the last 9 months. We're going to have to do those things. But the good news is we'll do better. With the addition of the vaccine and the masks and the social distancing, we should be able to have our businesses open. We should be able to do a better job with gatherings and with schools, and we should just be able to function at a much higher level, a much better level. So it's not like it's going to automatically just flip the switch and we're going to go back to normal. The goal is to get there, but it's going to be a while, people, before we can put away our masks and before we can stop thinking about crowds and how close we are to people and whether we're sick or not. So just keep that in mind, please.
Thanks, Doc. All right, next question. When I have received the 2 doses of the vaccine, will it be safe to socialize with my friends and relatives who have also done the same, and grandchildren who are too young to receive it?
So we go back to how effective is this vaccine going to be? We know it's I'm talking about Pfizer now. We got probably a dozen more vaccines to come out. So each vaccine is going to have a different answer, but this vaccine that we're having, and probably the Moderna as well, reduces the risk of serious symptomatic infection. That does not necessarily mean that you are not able to transmit the infection. No one, I think, is going to say that if you get vaccinated, you're just safe to go, you're good to go, and you don't worry about anything. We can't go there yet, people. This is the first step, and a very important first step towards getting back our lives back. But this is not a switch that's going to turn on and off if you've had a vaccine. We don't know how long the vaccine immunity is going to last. We don't know if it's going to be a 6-month or a year. There's just a lot we're still going to have to look at and watch as we go forward. Do I think it will help protect you and your family? Absolutely. I think it will absolutely help reduce the risk to your family and to the people that you're trying to be with. And I think the more that we cocoon ourselves with immunity, just like any other vaccine, the better off we all are. But no one is going to tell you that if you get your vaccine and your brother gets the vaccine, that there's no question that you can't get COVID. I don't think anybody should. Please don't think that way. because that's just magical thinking.
All right. Next question. Someone said, I remember hearing a few weeks ago that 1 in 5 people in St. Clair County that we encounter in public likely have COVID. Am I remembering that correctly?
What I said was that close to 20% of our tests are positive. And that means that if, given a certain environment, there could be, 1 out of 5 there. Now, you remember the people who are getting tested are selected group. People are getting tested because they believe they've been exposed or they are feeling ill. So that's a little biased. And I think I'm going to have to we'll come back to this because I think, Brandon, we can look at our cases, assuming that perhaps we have, out of the cases we know about, we've got maybe 3 to 7 extra cases per ones that we know. We could probably do the math there a little bit and get back about how many people proportionally have already had the infection or might still be infected, and we'll get back to you. It's probably not 1 in 5, but when I say that 20% of our tests are positive, close to it, that's a lot of positivity out there.
All right. Next question. Is it true that once you have COVID, you cannot get it or give it again for 90 days?
Well, no, it's not true. We consider it's very unlikely to get reinfected within 90 days of having a confirmed COVID infection. Statistically, what we know. It happens. We don't know how often it happens, but we consider it rare. So is it impossible? No. There's lots of variations on the theme. We don't know if asymptomatic infections give you a weaker antibody response. Your age and your medical conditions may impact that. Some people think they have COVID and they really don't. We have false tests that are not accurate. So it's not really an easy answer. I would be cautious about that. I would say that if you've had COVID in the last 90 days, I would think that your risk of getting an infection is less. We certainly don't count you again as a case. If you got retested and were positive, we would not count you again unless you get past that 90-day window. But I would still be careful. I wouldn't just assume that you can't get infected and just kind of, do whatever you want. I would still wear my mask and I would still be careful around vulnerable people. And I would still be very cautious if I was getting sick to hunker down and not expose myself to other people if I was getting symptomatic.
All right. We're going to the live feed questions now. We had a question about a provider who I'm assuming did a PCR test and it went very deep up someone's nose. And then she had it at another facility and they went only halfway up the nose. Can you speak on that?
I'll take this one. So there's a couple different ways you can do the test, right? So you can do just a regular nasal test, then you can do a nasal pharyngeal test. They've changed the way they've done it now since the science has gotten better in the last 280 plus days. So just because one office does it one way and another office does it another way doesn't mean it's invalid. It just means that they're doing it differently because the lab they're working with is accepting the test differently. So don't think because one office did it one way and one office did it another doesn't mean it's invalid. It just means that they're accepting the samples differently. And that's what happened there. I would say, and I'm reading the question too, I can see it on my screen. Your issue is you had one positive and then another negative. Remember, and Doc's talked about this a lot, that depending on the time frame, you may have been shedding at one point and not shedding previously or thereafter. And that's sometimes the way this virus works. So that's just kind of the way it's going right now.
Yeah, tests are not perfect. You have to use the results of the tests with other information. Do you have exposure? Do you have symptoms? What your risks are? Because we know that negative tests can occur even with a positive individual. We know that people can have positive tests and be really not infectious anymore and recovered. There are false positive, false negative tests. So it's not really a cookbook kind of yes or no thing. I apologize. That's the way medicine is. And we'll just try to keep providing you the best information we can. You got to use your head, though. If you think you're sick with COVID, you should protect yourself and your other people from getting infected with it. And I mean, that's what I want to make sure people understand. A negative test, even and you're feeling sick and you had exposure 4 days ago, should not tell you to just kind of do whatever you want. It should tell you really careful.
All right. Next question. I've looked through tons of available information on vaccine rollout schedule for Michigan. Can you clarify where mental health workers, psychologists, counselors, social workers, therapists fit in the vaccine schedule? Are these professionals considered healthcare workers in this case or something else? Also, what about auxiliary staff in the healthcare setting, secretaries, greeters, social workers, administrative staff?
So let me just explain this first. This first round is going to be going to our frontline workers. Think about the people we need to physically show up in our doctor's offices, in our hospitals, in our ERs, in our ambulances, to physically transport and treat and take care of people who are sick. That is going to be our very first priority. People that support those systems and support other important health issues, mental health included, will be in the next tier. Okay, so there'll be a lot of overlap with this, but our first priority in the first couple of weeks here is to get our doctors and our nurses and the people that are doing respiratory therapy and the people that we need to show up to take care of people when they're ill. And so I just want to kind of preface that. It's not that anybody is more or less important, but you got to kind of fix the people who are going to be taking care of the people. And then once we've got that set, then we can start moving on and kind of protecting in a wider and wider range.
All right, thank you, Doc. Next question, can you clarify about the vaccine for pregnant women?
So yeah, from my understanding, the vaccine was tested in a variety of people, including 40,000 people. Some people ended up being pregnant after the vaccine or didn't know they were pregnant. And there was no clear safety issues related to that. However, clearly, when you provide a vaccine to vulnerable special populations like pregnancy, you want more data, and there's going to be more data coming. They're studying this much clearly. But right now, the vaccine can be used by women who are pregnant or think they're going to be pregnant or are breastfeeding or the immunocompromised. It has to be considered versus the overall lack of actual evidence that we have. So it's something you can consider doing. It has to be something that you make an educated decision about with your healthcare provider. And we will have more on that as this rolls out, believe me. But it is not at this time a contraindication, is my point. And that's how I understood the information that I just heard today, that it's not, being pregnant is not an absolute contraindication. So if you're a nurse or a doctor out there and you might be pregnant, but you're on the front with COVID patients, the benefit of the vaccine likely outweighs any risk. And that's because the type of, and then we're talking about Pfizer vaccine now and Moderna, but the mRNA vaccine is not a live vaccine. It's not a live virus. There's no viral component at all to it other than the RNA component that codes for the protein. It doesn't go into the it doesn't go into the nucleus. It's theoretically something that would not cause a problem in pregnancy, the way it works. But more to come on that, and we'll definitely share more information as it comes out.
All right, next question. How are we doing against the reopen metrics? For example, trending on percent positivity, hospital percentage, case rates?
We're still in the very high category, so we're not doing very well at all currently.
Mm-hmm.
All right.
We're coming, as I mentioned, we're not peaking, but we're still at a very high level. So, and I'm assuming the matrix she's referring to is the matrix that we're using to kind of guide our schools to decide.
Yeah.
Mm-hmm. And so as you know, some of our schools, despite being in those high rates, are doing okay, staying open with the K through 6 grades that are being allowed. And so that conversation is ongoing. Every week we're having that conversation with our schools to see how they're doing.
But to do that, they're having to use all of their school district resources to keep their K through 5 open. So.
All right. Next question. Will this vaccine shed?
No,
it's not. This is not a live vaccine. There's no viral anything. There's no dead virus. There's no partial virus. The vaccines that we have in the next month or two, who knows what we're going to have beyond that. But not to say that there's a variety of vaccines being developed, but the two that are coming out immediately are mRNA vaccines. It's a technology that's new, but not brand new. It's been around for a decade or more. We've used it for various things. But there is no viral component. So it cannot give you COVID. You can't create an infectious condition with this vaccine. The vaccine, the mRNA component, goes into your muscle cells where your cells produce the protein that presents to your immune system. And then your immune system prepares its defense against the real thing when it's exposed to the real thing. Now we'll get, next week, by the way, I just mentioned that we're going to have kind of a session all on vaccine. There's also on our website, we're going to please go to our website. There's some great videos on what an mRNA vaccine is about, what it does. This is something new to everybody, and I just want people to learn and read about it as much as they can. It's really important for people to understand what we know and what we don't know. And there's a lot of myths and misinformation out there that we really want to make sure you fix.
All right. Next question. I appreciate all the answers, but in all honesty, how likely are any of us to actually be able to get the Pfizer or Moderna vaccines based on known numbers in each category? And then she says, how many medical care workers and nursing home patients and workers are there in the county?
Between 3,000 and 5,000 potentially. Yeah.
Yeah. So 1A, we figured about 3,000 to 5,000. We don't know how many of those will get it, but we're prepared. And the answer is, yeah. I think the answer is, of course. I think everyone's going to have access to this vaccine. Will it be Pfizer or Moderna, or will it be a different one? I don't know. But certainly the intention of the federal government and public health is for every person who wants a vaccine to receive one. Will it happen in January? No, you're not, maybe not even February. In fact, what I'm hearing is we're thinking perhaps late spring. If you listen to Dr. Fauci and NIH, they're talking possibly even into the fall before the majority of Americans who want a vaccine can access it. So it's going to happen, but people are going to have to be patient and smart.
All right. Next question was, what category are public school teachers in?
They'd be the 1B.
1B.
Is that right, Justin? 1B?
Yes, ma'am.
Mm-hmm. And we will post these priorities. I don't know, at least if we've already posted these priorities anywhere, but we'll get them up so people can see this all available at the MDHHS website as well. It's very clearly defined. It lists everybody where they are. And so you can kind of see where you might fall in this category, and we'll walk everybody through it as the vaccine comes in.
All right. Justin, you mentioned how the vaccines will be distributed. However, children were not mentioned. I'm assuming they are last?
Well, so right now it's only approved for people 16 and older. So that's where we're at right now.
All right. This is also for you, Justin. Is this a mandatory vaccine?
So it is not a mandatory vaccine. The federal government nor state governments cannot make a vaccine mandatory while it's under a EUA. That I can't speak to what may happen later on, but for right now, it is not a mandatory vaccine.
And we're not aware of any conversations by anyone who's recommending or considering mandatory, even within the healthcare systems. Nobody is is I think
Right.
discussing a mandatory component at this time.
Yeah, you get better buy-in by asking people to do things than forcing people to do things. So,
All right. What is our current transmission rate for St. Clair County?
16.8%.
Okay.
No, that's the percent
Oh, yeah,
positive.
you're right. Hold on one second. Let me pull it
testing.
up. Yeah, hold on a second.
That would be a Brandon question.
Brandon, do you have that?
It's
Yeah,
over one still, I think.
so our RT, or our transmission factor, is just below 1. So for every one
Okay.
person that gets infected, they're infecting slightly less than one person right now in the state of Michigan.
All right.
I believe the last number I looked at, it was 0.92, which is very positive that we may have a downward trend in cases because of that.
And we're seeing that, right? So the proof's in the pudding on that one.
And this next question goes along with that. It says, Doctor, where are you getting 20% positivity rate? Appears to be showing much lower positivity rates.
16.9.
16.8.
Yeah. You know, and I apologize. I tend to be a little dramatic because when we were getting 18.7 and we we're getting up to that 19% range, I round things off in my head. I apologize. I do that. So you're right. You're right. So we'll keep it. It's 16.9. It was higher than that. I don't think we ever quite hit 20%. I'm a little bit of an alarmist. I get a little nervous when we get up there. But you got to remember that when we measure things like this, percent positives and cases, you know, this is not like we are going through and testing every individual in a certain population and then being able to tell you what the percent positive is. These are kind of like we're testing different people. There's biases involved on who has access to testing and who can get their testing and when we get it done. And so you've got to take all of these numbers with a certain grain of salt. As I've said over and over again, these are not numbers that you like say, okay, this is exactly what we have. These numbers are to help us understand the scope of the problem and which direction we're going in. So thanks for calling me out on that. But I still think 16.9% is pretty darn close to being too high. That's what
All right. And we have a question just asking, can you clarify again where public school teachers land in the priority
1B.
groups?
1B.
So they will be after, you know, essential workers, not to say that they're not essential workers, but they'll be after our cops and our firemen and our ancillary staff and our critical infrastructure people. And we'll probably start working on them as soon as we're comfortable that we've vaccinated that 1A group.
All right. Next question. Will the police be on the category for doctors or mental health since they are exposed to it daily, all day long?
They're essential workers, so they would be 1A tier B or tier 2. So as soon as we get those doctors done and the nurses and, you know, the medical assistants, the people that are working with COVID illness, then we will start working on the cops and the firemen and our first responders and the people that we need to function as a society. Yes.
Okay. Next question. The trends on the state site are showing flattened or trending down for case positivity, but there doesn't seem to be any apples to apples comparison to the metrics being measured. Seems counterproductive to create a metric and not measure directly.
I don't understand the question.
Yeah, we can't
take this one, Doc.
Go ahead, Brandon.
Okay, go ahead.
I would refer you to the My Start map, where the state looks at cases on a 7-day average per million population, which you can easily compare areas. So like St. Clair County to other counties. Same thing with percent positivity. It's trended out over time.
And I guess when I hear a question like that, I guess what maybe you can respond back. again, kind of rather than discuss the nuances of the data and pulling the underlying concern of why that data would be irrelevant in what way. So, so when we look at trends going up or down, I do think that, if the information is not helpful to you, then maybe you're trying to interpret it incorrectly, or maybe you think that there's a way that information should be given that gives you information that maybe we're not trying to give you. I don't know if I'm making any sense, but please let us know if there's something underlying that question that would help us respond to it a little bit better. Because the data is complicated and the nuances are forever, but we want to make sure that you understand kind of what we're trying to glean from the data and what we're trying to show from it.
All right, next question. You probably answered this before, but I'm wondering if one has a positive test and had recovered, should they retest? Thank you.
Yeah, no, that's a really common question. And I do want to say that retesting at this time, we don't think is very productive. Okay, at the beginning, there were protocols for retesting before people came back to work. And what we found is that some people stayed positive for long periods of time, and it was unrelated at all to them being infectious. So we just encourage people to follow the clinical guidelines. So if you get tested and you're positive, you follow the 10-day rules, make sure that you have been at least 10 days from the onset of your symptoms or your positive test, and that you're feeling better and you don't have fevers. And you can be fairly certain, not 100%, but most people, 99% plus, are no longer contagious at that point. And so you can use that as a guide. And if you go back and retest, it can just be very confusing. And so we don't, rapid antigen tests probably aren't going to stay positive very long. They tend to get negative really quickly. But those PCR tests, those molecular tests that we do, sometimes people will test positive on those for long periods of time. And I don't know what to tell you. When we get those back, we have to assume you're still positive. We keep you out of work for even longer, and it becomes a real mess. So I would encourage you that have been released by the CDC and MDHHS. They're the best guidelines we have. They're appropriate for trying to keep the disease transmission under control. Nothing's perfect, but it's the best guidelines we have.
All right, thank you, Doc. We just had some comments thanking you and Justin for the Facebook Lives, invaluable information. Next question. What if you are in the 65 plus group, but will be in Florida during January and February? How do you get the vaccine?
I don't think you have to be a resident of a state. I think you can get it anywhere you are. Justin, have you heard any? I certainly don't think anyone here is going to require residency proof or anything like that. No. So we're not going to ask for residency information before vaccinating. So I would think if you're somewhere else and the vaccine's available to you, you would be able to get it there. You're going to get registered through a state registry, vaccine registry system. You're going to get a card that tells you that you've been vaccinated. And when your next, remember these two, Moderna and Pfizer, you need 2 vaccines. Really important that you get both. But so you're going to get a card that talks about when your next vaccine is. So I think that issue of people keeping track of where they get vaccinated is going to be fairly manageable no matter where you get it, I think.
All right. Thank you, Doc.
Mm-hmm.
Next question. Just wondering where retail workers fall into the line as far as vaccine.
2.
Yeah, they're 2.
General public. Now remember, before the general public is people at high risk. So if your retailer is over the age of 65, if they have chronic medical conditions, they would kind of be up a priority level from just everybody else. And of course, some of it depends on what kind of retail it is. If you're a critical, what do you call that when you have supply chains and things like that, that might push you up. I mean, these are great questions, but I have to say, I think we're going to have to just walk through these based on several scenarios. Number one, how much vaccine do we have in our hands, right? So these vaccine allocations are going to come to us for a while, we're not going to just be able to order what we want. Okay, so that's one. Number two, what other vaccines are coming out, how effective they are, who will they be indicated for? There may be some vaccines that are going to be very much specifically for one group or the other. And then a lot of it is going to be who wants vaccine. You know, there's still a lot of people out there who are not sure yet, and we want to make sure that people get all the information they need to make a good decision. So there's going to be plenty of time to walk through this. And that's why it's so important for people to not think that this is just a switch that's going to get pushed on and we don't have to worry about COVID anymore. We're going to be living with COVID concerns for quite a while longer. And we all need to keep up the masks and the distancing and the things that we've been doing, because this isn't going to be an automatic solution. We're going to get there. This is the beginning of it, but it's going to be a process that's going to take a lot of work to get there. And I just want everybody to be patient and work with us and understand that this is not like something that we've all figured out and we've got a playbook for. And we're just going to kind of open up the playbook and just kind of boom, boom, boom. My guess is in 2 months, we'll be sitting here telling you somewhat different story about what we're doing and how we're doing it. And we're just going to have to make the best of that.
All right. Thanks, Doc. Next question about industrial plumbers. Are they, as they are considered public health workers, the question says, where are they on the receiving list?
They may be considered essential workers, but I'd have to get guidance on that from potentially the state.
You know, I really think that when we get to those things, those really important functions of our society, there's no question there are so many jobs that people have that are so important. Right. We don't even think about it until we're struggling without them. But so many of these things are going to they're just going to play out pretty naturally. Yeah. When that vaccine is available to just broader groups, I think it's going to come through your industry. It's going to become apparent that this is kind of, your industry's turn. And like I said, there's going to be overlap between different priority groups. So as long as we feel like we've covered the most important ones first, I mean, what the government and the state doesn't want us to do, and that what is really trying, is for instance, a community like St. Clair County, which, by the way, we got rock stars here. We work together great. We have just great working relationships, and we can get things done in this community. I really believe that we're going to do a good job with this. We can get this done. And then you maybe have another community that's not doing so great. Maybe they're struggling a little bit more with resources or, whatever. They don't want one group to be way ahead and moving on where another group is still struggling to get even the basic 1A group done. There has to be equity and some just distribution. When you have a limited resource like this that is so incredibly important that you can't just kind of willy-nilly put it out there and may the best man win. We have to do this in an equitable, fair way, which means we're going to be following rules. We're going to be kind of stepping forward and stepping back and reevaluating what we're doing as we go. And we're gonna reevaluate everything we do as we do it and make sure that we're doing it right. And I'm not promising we're not going to make any mistakes, but we're going to be careful with this, and we're not going to rush through this. We're going to do it right, and that means people are going to have to wait. They're going to have to wait, and they're going to have to wait their turn. Maybe a little bit longer, maybe than their neighbor in South Carolina. I don't know, but that's just the way we're going to have to do it.
All right. I want to be mindful of time, but we had questions that came up yesterday about the holiday season coming up. Any advice on people who are thinking about gathering?
Okay. We know what we went through. We've just gone through. We've just gone through a really rough period. And as Justin said, I don't feel like we're out of the woods yet. I can breathe a little bit easier now that our hospitals are holding on well, but This is really serious stuff, guys. This is when you're in part of that 15 to 20% group that's having significant illness and you need health care and it's limited. We still have to take care of each other. This is not a virus that is just going to disappear because suddenly the governor's restrictions have gone away. You know, the virus is with us. It's going to stay with us, and we know that it's going to spread if we get together. Please be careful. Please be careful. It's a brutal virus. It's just brutal, and I want people to know that the holidays are rough when you can't do everything you want to do, but they're a lot rougher when the people you love are sick or dying, or are really struggling. So we would ask that you hold the course, that you stay the course, and you do exactly what we've been asking you to do for the last 6 to 8 weeks. If our numbers come way down and we're suddenly in another window where there's not a lot going on, we'll tell you that. But we are not there right now. We are having a lot of transmission and a lot of illness still. And if everybody lets their guard down over the holidays, we're going to have another problem surge 2 to 4 weeks later again, just like we just got through. So I'm asking people to stay the course and do your best. We've made it this far. My God, we have made it this far. We can do this for a little bit longer. We really can.
Yeah, and so like I said before, we're at 280 plus days, and I know this has been a really long time, and we can, the finish line is getting closer, but we aren't there yet. And I would hate to give up all this ground because we want to have some short-term fun. I know we all want to have a really wonderful Christmas. Trust me, I get it. But, this country was built on sacrifice. And unfortunately, some of us need to sacrifice just a little while longer so that we can make that long-term gain. So I hate that I have to say that. It's not something I ever thought I would say, but we just need to hang on for a little while longer. I implore you all. So just do the best you can, and we will make it through this. And I appreciate all the hard work that everybody's doing in the community. So with that, have a good week, and we'll talk to you next week on Tuesday.